I'm Colin Smith, interviewing Shaun Hicks. We will be discussing the South Flight helicopter program at the University of South Alabama. When did South Flight begin and why?
Well, South Flight began in September of 1986, and it began to assist in rapidly getting trauma patients from rural areas like rural Mobile County, Washington County, and Baldwin County back to a level 1 trauma center, which is the University of South Alabama Medical Center, in a more timely fashion, and that's important to save their life, and that's really why the aeromedical program came about.
As a flight paramedic, what things in the air do you have to do differently than you would in an ambulance, a ground ambulance?
Well, I think the main thing that we do differently in the aircraft is we lose one of our senses that we have on the ground, and that is we lose our ability to hear. And on the ground, we're able to put a stethoscope in our ears and listen to our patient, either heart tones or listen to their breath sounds. But when you're in the helicopter, we wear a headset because the rotor blades are so loud. So we lose that ability in the air. So this is the one time as a paramedic, and we learned this in school, is our instructors always teach us, don't treat all the monitors. We have all kinds of neat little gadgets and monitors and cardiac monitors where we look at patients' vital signs and everything, but we don't treat the monitors, we look at what our patient's telling us. Well, in the air, we have to swap that around a little bit because we lose that one sense, which is very important. So a lot of times in the air, we have to look at our monitors and rely on our monitors to tell us what's going on with the patient. Whereas on the ground, we're able to use that extra sense that we have.
Do you like being a medic in the helicopter more or on the ground, and why?
Well, I think I like, both of them are very enjoyable jobs, and I've been doing both for 29 years now. I was a flight medic at South Flight for 4 years of my career, but that was the most rewarding part, was the flying on the helicopter. And the reason it was, I guess you say, the most fun or most rewarding, it was the most challenging. If you like a good challenge, that's where it was at. Because when we were called into action or called to a scene flight or to pick up a patient at a rural hospital and bring them back to a level 1 trauma center, these were the sickest of the sick and the most hurt patients, and you had to really be on the top of your game to take care of them and make sure they survived to get back to the level 1 trauma center so they could get further care in that process.
That's all my questions. I don't have any more questions. Do you